thank you for joining us this afternoon. Could I ask everyone to sign into the chat, please, with their name and organisation? It just helps us a little bit later on. And as we go through the presentations, we'll be inviting you to put questions into the chat, which we'll respond to at an appropriate point. We will be recording the event, and we'll send you a link so that you can watch it again if you wish to, and we'll also be sending out the slides. We've just been through an exceptionally challenging year in the care sector. On the plus side, our sector's had more visibility than ever, with a better public understanding of what we do. On the other hand, some of us and our staff are left feeling somewhat bruised and battered after what we've been through, and public finances are facing a huge challenge. Against this background, we wanted to look again at recruitment, always a key issue in our sector, especially now. And speaking to ECA members, I know that this is one of their major concerns. For this reason, I'm very happy that Amanda Marcus will be speaking to us this afternoon. Amanda is the director and owner of Cohesion and is a championing social care ambassador, amongst other things. Cohesion, for those of you who don't know, have been delivering values-based recruitment and workforce solutions for social care and health care clients for more than a decade. They have a comprehensive range of services, which I'm sure Amanda will mention at some point. And they also work with the National Care Forum, Care England and care associations around the country. So particularly pleased that they decided to work with us this afternoon. I met Amanda virtually earlier this year when she presented at a national webinar, and I was impressed by her grasp of the issues and her practical approach. I'm sure that you'll find some useful takeaways from the presentation you're about to hear. Amanda's joined today by her colleague Dave Beasley, who is the Social Care Talent Director at Cohesion. So without further talking from me, I will hand you over to Amanda. Amanda.
Thank you so much, Simon. That's a fantastic introduction, and you didn't even have to give you any money for that, haha. So much appreciated. So really appreciative of being here today, and as you say, it's been just such an incredible set of circumstances over the last 18 months now, and certainly not like anything any of us have seen before or could possibly have predicted. So today is really about sharing what's happening in social care recruitment. But before we start, I am indeed going to just touch very briefly on what we do in order to set the scene. So in a nutshell, Cohesion support social care providers with recruitment and workforce solutions. Our clients span large and small operators, both in the private sector and in not-for-profit and across all care settings. So we believe that this puts us in an informed position to share both our insight into what's happening across the sector, as well as our recommendations for how you can improve recruitment results in your organisation. I am not going to talk through these on the screen, but these are the different recruitment and workforce solutions that we offer. What I am going to be sharing today is our top 6 themes in social care recruitment from 2020-2021 that we think you should be thinking about and considering, along with some recommendations. And we are calling it, this is my proverbial drum roll, our hot half dozen. So first up, next slide please. First up in our hot half dozen is capitalising on the increased interest that we've seen in the sector. And without a doubt, that there has been an opportunity really to capitalise on it. Clap for Carers, the news in general, and the DHSC campaigns have all had an effect. And we have seen greater and more diverse interest typified by higher applications in general throughout the time of the pandemic. And specifically, back in the spring of last year, across 4 clients, we saw an additional 1,000 applications a week outside of BAU activity, which is just staggering. And key worker campaigns and alternative offerings certainly had an impact on that. So we've seen a lot of providers change their approach quite quickly from come and speak to us and tell us when you can work and we'll consider it, rather than this is what we need from you. So shorter term contracts have worked well, and we've managed several specific key worker campaigns, some of which offered a 3-month role where might get involved with caring duties, domestic duties, or catering duties. And specifically, some of the big 6 have actually looked at care assistant roles where you don't need to provide personal care. Now, that is a huge departure from the norm in the sector, and I guess something to think about when we all have a chance to digest, did it work? I'm not so sure that I would have been recommending. In fact, I wouldn't have recommended to our clients pre-COVID that you should go to market and advertise frontline workers and without the requirement to deliver personal care, because it is such a big part of the job that we do. However, I can understand how in a COVID environment, some of these more flexible contracts may actually have given people on furlough or out of work the ability to have a bit of a dress rehearsal and start to understand what perhaps they didn't know. You know, maybe they'd never thought of a career in care before. This gave them the opportunity to see that. Now, the jury is still out on what the retention in those workers have been. It's certainly something that we'll be looking at as we move through the year. So definitely an opportunity to look at different ways of attracting people. Our top tips are to process applications as soon as possible. Backlogs just don't produce the same number of conversions. We supported some organisations in 2020 where application levels rose and they didn't have the capacity internally to screen. Frankly, if you've left people for a couple of weeks, they're not going to be available when you go back to them, or certainly not as many of them are. So, you know, we say within 24 hours, within hours if you can. It's really, really important. So if I consider our usual levels of people withdrawing in the recruitment process, last year we saw 10% more withdrawing during the recruitment process. Were they click happy? Possibly. Did the supermarkets get to them first? Quite possibly. Did they realise a little bit more about what the role entailed and were perhaps put off by some of the negative stories in the press about some of the deaths of staff and residents and the lack of PPE? Absolutely, that will have had an impact. But the sooner you get to them and can have that conversation, the better. And flexibility in employment offerings. This is easily said, I know, and not as easily done, but we do recommend considering how you can offer greater flexibility as much as possible when it comes to shift patterns. And a lot of the diverse candidates that have been attracted to social care during the last year may well find themselves shut out if there aren't viable options for them to consider. And do nurture interest from underrepresented groups. And so we know that Kickstart funding is still available for early talent programs, but that's just one example of what can be done to improve on the low levels of young people working in adult social care. Again, I'm sure you will know this, but less than 10% of the workforce is under 20, 24 and younger. But that doesn't mean that we shouldn't also consider how we can attract older workers or other underrepresented groups like men. There's not many men in frontline care roles when you compare it to the size of the female workforce. So interestingly and quite charmingly, the number one category that young people are interested in when registering for the National Citizenship Service is to volunteer with old people. So there's definitely an opportunity there to consider. Now, we understand that when you're nurturing interest from underrepresented groups, it might sound like it takes time, but with the right messaging and content on your on and offline channels, you can appeal to a wider audience of potential talent. And really simple things like, you know, write your ads differently. You know, put a different ad out and think of who your target audience is. Write it to them. Try writing it with different imagery. Use different imagery on local posters. And we do a lot of A&B testing, and that really can have an impact. It's also worth noting that whilst we're working in an environment where the Institute of Fiscal Studies is reporting that of all the different demographic groups, COVID-19 has has most affected young people. So they predict a prolonged negative impact on career opportunities, earning potential, etc. At the same time that younger people report suffering from a lack of confidence, and also more and more in the news about mental well-being. So whilst you're capitalising on the increased interest, I would also suggest considering the pastoral care involved in the recruitment process. How can you help people do the best that they can at interview, or know as much as they can about your full-time? Thanks, Dave. Next slide, please. So digitalising the recruitment process. Digitalisation has been a real buzzword in the last year. I seem to say it in every other sentence. Now, it's not surprising that we've seen lots of changes to the recruitment process, because we all just had to get on with it and deal with it when everything happened last year. So it's screening and assessing and interviewing and onboarding, learning and recommendations have all formed part of a recruitment process that now actually is totally digitalized. So it's not unusual to see organizations that we're working with getting to offer in single digit days. Now, when you consider conversations about people saying, well, it's really hard to recruit, how long does it take? It's not unusual for a typical cycle time to be 30 days, for example, including pre-employment. We're seeing a lot of people get to offer in single digit days. Kind of makes sense, doesn't it? You get an application, you phone the candidate, you speak to them, you do a values-based interview, they're good, you book them in for a final stage interview. So actually they can be entering a pre-employment process sooner than pre-COVID. And of course, we've had a relaxation of some of the background checking compliance rules during the same period of time. That being said, it's certainly sped things up. It's not been unusual, but some of the things to consider where you have a totally digitalized process, you can book interviews with the hiring manager and do an interview on Zoom. You could do it on Teams. That's great too. But if that candidate has never seen the setting that they're going to deliver care in, or hasn't been able to come into your service, then our recommendations would be to think about how you can bring that to life for them, whether it's a virtual tour or whether it's a day in the life of, maybe it's just an in-depth chat with somebody that joined you recently to give them their view of what it was like. And whilst we keep using this buzzword of digitalization, we think it's great where you can speed the process up, but technology should support the recruitment process. It should never replace humans. And we would also suggest thinking about the process. Is it the right process? So again, putting things online will make it faster, but it's also worth thinking about who does what. And we've seen a lot of changes. We've seen changes in who was interviewing for frontline roles across the last year, 18 months, to free up the operational teams a little bit more. We've seen people move where pre-employment sits from administrative teams to the person that's managing the recruitment process, again, to stop the discontinuation of a single process. That's worked well too, and it can increase cycle time. So lots to think about in terms of, is this the best place for this to sit? Is this the best person or function to look after it in terms of that digitalization? Next slide, please, Dave. Values, thank you. So number 3 in our half dozen is values-based recruitment. So we hear these stats on a regular basis. We all know that we need more than 500,000 frontline workers by 2035. And at any given day, I don't know the exact figure today, but it will be over 100,000 vacant positions right now today. So values-based recruitment is now more important than ever. And particularly given what's going on over the last few years, you will likely have workers now that hadn't considered working in social care previously, but they love it. And they really feel like they found their vocation. Others may not be so sure. So being open to values-based recruitment can really help managers to to understand who has the right values. And we did some analysis of one of our nationwide clients, and it happened to be a learning disability provider. And 61% of candidates that have been recruited in the last 6 months haven't come from a care background. Interestingly, 36% of their hired candidates in the last 6 months came from retail and hospitality. So definitely some things to think about there. Often managers, we understand that managers, gosh, it's such a such a lot required in the role of a manager, and we really understand and appreciate that sometimes there's a desire to just want somebody that's perhaps done the job before, and we do understand that. But our steer and our recommendation would be to make sure that you've got good balance on the team. Just because somebody's done a job before in care, it doesn't make them the best potential carer. So we would suggest really train and support managers, but do understand that you need to have that balance. I've just seen a question pop up, and we're going to come to questions at the end. And I think it was Sandra who will share some values-based questions, and happy to share other materials. We can suggest values-based questions, but actually values-based questions based on your values are even more effective, where you put some time into thinking what are the positive and negative indicators. What would our best carer say in response to that question? So we recently launched a tool called Care Character, which is an online, really an engagement assessment built from a PhD that we sponsored at Aston University. And the PhD was looking at what are the best methods for recruiting frontline workers in the UK for frontline care roles. It's very, very, very big document, but very, very interesting. So we took the findings from that, and Dr. John Barrett, who now Dr. John Barrett, worked with several dozen care providers, small, large, regional, national, local, again in different care settings over the course of the 4-year PhD, to really drill down to what are the best qualities for care, what values should we be looking for, what will be an indicator of potential. And we've used that to make Care Character. We recommend that candidates do it ahead of their final stage interview, and it takes 7 minutes to complete. 75% of candidates that we send it to are completing it at the moment, and it is a really good indicator of whether or not people are going to turn up for interview. It's really, really actually boosted that. So much more likely to turn up for interview if you've done your assessment. 90+% of candidates say it really helps them in the recruitment process. And we're starting to see really interesting applications in terms of ongoing learning and development in the organisations that are using it. And of course, it's supporting managers because it produces a report for candidates, which helps them to do well at interview. It also produces a report for hiring managers and gives them specific values-based questions. And it also produces a third report for the people that you support or their families. And the idea being, this isn't about culling candidates, it's about intervening to help people do better. It's about helping managers make better hiring decisions and looking at potential and looking at values. And it's actually also about differentiating and engaging with that candidate. So if they're applying to lots of different entry-level jobs, it's not many entry-level jobs that are going to give you a really validated report about yourself and how you can do well. So we've implemented values-based recruitment across, I'd say, at least a dozen clients in the last year. And we're actually offering, if anybody wants to try to use Care Character for your next 2 hires, offers out there, give us a call. We'll set you up with some training and you can have a look at some of the reports and how it works. So I'm going to move on to my next slide, which is better engagement. So I've mentioned this. So we've seen Number 4 is better engagement. We've seen much faster deployment of technology in the last year, and that's certainly not a bad thing, as we said. If I think back to, I'm sure many of you, but not all of you, will remember the switch to online applications, and that didn't happen nearly as quickly. We went through years of saying apply online, but you can also post your CV to us as well, and that kind of makes sense. With COVID, everything happened super quick, and we went completely online overnight, pretty much. We're actually seeing learning and development being added to the recruitment process, and this is improving dropouts. So across all of our clients, where we run an end-to-end recruitment process, so attraction, screening, assessment, engagement, pre-employment, onboarding, retention interview, second retention interview, in that piece where we're taking references and dealing with compliance, as an average, I would say we lose 25% of candidates, 20 to 25% dropouts. I've had many conversations with providers who say their figures are higher, not as many where it's lower. Now, we've worked with Key Change Charity for a year and a half now, and what we did was to put learning. So at the point somebody enters pre-employment, we gave them access to online learning modules, and that actually shifted the dropout by 5%, which is quite interesting. And we're now talking about putting learning and development and making it available at the point that people apply. So again, you're kind of ticking a lot of boxes there. You're engaging with them as an employer, you're giving them a positive recruitment experience, and equally, you're helping your candidates actually understand who you are and what you do. So some of those modules could be about you. It could be an introduction to the organisation. It might actually be an introduction to end of life, what that's like to work in a service where you're dealing with end of life, or what it's like to deliver personal care. And I guess we see it as a positive double-edged sword, because if the engagement works, then they're going to move through the process positively. If they decide, oh my goodness, I've not worked in care and that's just not for me, then actually our view is we'd rather them drop out earlier in the recruitment process and not take up the manager's time, be offered a job, start that job, and then decide it's not for them. So that engagement during the recruitment process can really help. And we're seeing, we haven't seen implementation stop. So in terms of applicant tracking systems and using those to engage candidates, lots of people that we're talking to are still going ahead with that. And so our tips would be, think about the process and the technology that you're using. The right applicant tracking system can really drive better engagement, and that's quite important. But think about adding online learning to the recruitment process, and don't stop asking for referrals. I guess the key is communication is absolutely critical. And I'm conscious that we have a really mixed audience today. If you are running one care home, if you're an owner operator, I would still say that these apply. You may not be using applicant tracking technology, but communicating with candidates and making sure that they know where they are in the recruitment process is really important. And if anybody would like an offline conversation about some tips on how you can use technology if you're a smaller organisation, we'd certainly be happy to help and do some pointing in the right direction for you. Next slide, please, Dave. Thanks. So, agency spend has, without a doubt, generally reduced during COVID. I guess our concern is, as we horizon scan, is that there is a danger it will rise now that other sectors are opening up, and we have more freedom of movement. And we just couldn't use agency staff in some cases in the last year. In our view, an additional funding that's been available has also supported that. And in our view, engaging bank workers and really maximising your existing team and bank staff is the key challenge. So it's not unusual to use agency staff for someone being on holiday, someone going on a training course. You know, all of those can be avoided. We need really good agencies, and there will always be a place for them, in our opinion. However, that should be when somebody calls in sick last minute and you don't have someone on the bank. So that would be our steer, is to think about how you can develop the process, the technology, the expertise to almost have your own in-house agency, or seek a partner to help. And part of that is about understanding where agency hours are more prevalent. I would also suggest, depending on location, it's really about the demographics in the area. If you're near a university that has nurses or health and social care students, they can be a really great audience to engage with to build additional bank capacity. Right, next slide, please, Dave. Thank you very much. Retention. Is there a storm brewing? I hate to say, but we think there is. The Skills for Care workforce report, which comes out annually. Actually, I can't remember a year when we haven't, as an industry, hovered around 30% in terms of turnover. I've got a sneaking suspicion it's going to be higher this year, because people have joined the sector from other areas. They're going to return. The client that I mentioned earlier, all of those people that came from hospitality and retail are going to be asking themselves, do I stay or do I go? People are very tired. I think there's a degree of exhaustion, both mental and physical, from the work that they've gone through. And so it's going to be challenging times ahead. And we're certainly seeing different behaviour in different workforce groups. So, for example, we're pretty much not recruiting nurses anywhere successfully. I mean, nurses just aren't moving at the moment. And I don't know anyone that is successfully doing it, whether in the UK or overseas. And that kind of stands to reason that may change as we come out of COVID and into the second half of the year. I mean, historically, providers have told us that retention is harder than recruitment. And I'm not sure that that's changed. I'm not sure that that's changed at all. So lasting impact on retention needs to be to really look after those new entrants and make sure that they have a positive employment experience. And so some of our top tips is how can you have an impact in these stressed and stretched times, and when we always have other demands on our time. Plan how you're going to engage with new starters. And that doesn't always have to be formal. It can be informal too. It could be a virtual chat. It could be a virtual coffee. It could be a stay interview. You could assign them somebody else on the team to catch up with them on a regular basis. But stay interviews are a great way of building trust and engaging with new starters, as well as understanding at key points after they've joined. You know, onboarding doesn't end when you've picked everything on your list for week one. It's an ongoing thing. We do a two-stage retention process when we recruit for our clients. We do it at week 2 and we do it at week 8, and we ask a whole host of questions, and we regularly analyse that each year, and it's interesting to see what comes out. And quite often you can catch things that might be issues before they become issues. So, for example, we heard from a cohort of night shift workers, that they'd been there 2 weeks, they hadn't actually seen their manager yet. Now, that wasn't by design. The manager wasn't avoiding them. She was on a different shift pattern. So it's great to catch things that you can practically put in place and just understand, you know, how happy are people? How are they finding things? You know, is the job living up to their expectations? Is there anything that they love to do that they think they could come and do at work with the people that you support? You know, what are they not getting? And one of the big themes that came out of our last analysis was that a lot of frontline workers, they want to know within their first 8 weeks of working in an organisation how they go. So I'm trying to read the notes at the same time. Debbie will definitely come back to that at the end. So they want to know how they can progress within the organisation, even if they've only been there for 8 weeks. So really understanding what those development pathways can be, and signposting people and giving them things to think about, that's a really powerful thing to do, and it works incredibly well. But I guess if I had to summarise the biggest thing with retention, it would be flexibility, followed by flexibility, followed by flexibility. And look, we know this isn't easy, but the more that you can consider that, the better. And you know, ask your existing team now what they think, and where they think you could be more flexible, or what the niggles are for them, or what the obstacles are for them. But it's a great way to then put that into your recruitment process. Okay, so next slide, please. Leading nicely on from our retention slide is an open invitation to join us when we will be analysing the thousands of exit and retention interviews we've done since COVID began. When we wrote this slide, we were hoping to confirm a few guest speakers. We've got one confirmed. So James Sage from Lloyds Withy King will be joining us, talking about the impact that dealing with particular legal issues with your staff can have on your retention. And we've got another guest speaker to be confirmed. So as we get closer to July, we'll share with Simon the details of how you can sign up. Yeah, we'd love to see you there. Next slide, please. Thank you. So I've seen a couple of comments come up as we've moved through the presentation about can we support with questions? Can we support with technology? And absolutely, the answer to that is always going to be yes from us. We are launching a toolkit which will be on our website, which will include all of these elements of the 360 recruitment process. So you can more than welcome to use that with our blessing, and be really interested in any feedback that you might have. Next slide, please. Care Home Open Week. So I don't know how much I wanted to give this a plug, because as Simon said, I am an ambassador for championing social care, and Care Home Open Day didn't happen last year. We've planned a week this year. So I've just taken my Cohesion hat off and put my virtual Care Home Open Week hat on. The team at Championing Social Care have worked on templates that can help any provider who wants to get involved. What we want to do is show what an amazing sector we are, what great places to work, and the amazing lives and stories of the people that live within our services and homes. As an outcome, it'd be great to get more volunteers and more interested people wanting to work in the sector. So if you want to do that, do you know, it does say care homes. I think you could apply it for learning disability services, but the name doesn't lend itself as brilliantly as I would like, Emran, just to answer your question. And I don't see why a domiciliary care provider couldn't join, actually, if it was a virtual event. But that's a really good question, and I'm going to take that away and I'll come back to you on that one. But yeah, there's more information on the website, and you can sign up and find more there. But I'm hoping you've got lots of questions. So I'm going to, I think that's our last slide. And I was going to ask Dave what specific questions came up during that.
Yeah, we've answered pretty much as we've gone, Amanda. So thank you. There's loads of interest for care character, and don't worry if you haven't had a chance to pop down in the chat that you're interested. We'll make sure that everybody who has joined knows how they can sign up to give care character a go for your next 2 hires. So that's great. The other questions we've covered as we've talked through. So I guess I'm going to open up to the floor now. Are there any final questions, queries, comments, or thoughts that perhaps we haven't covered today that we can help you with at all? And at this point, you're welcome to take yourself, if you're feeling extra brave, you can take yourself off mute and talk to us.
Simon. Oh, new providers, where to vacancies. Okay, so Emma's got a question there about new providers and the best place to advertise vacancies. So you guys have heard me talk for ages, so I might ask Dave for you to take that one, and then I'll chip in with anything else that occurs while you're talking. Is that okay?
Oh, yeah, no, absolutely fine. So the master of where to advertise, it's a really interesting question, and I think the first thing to say is what works in one area geographically, what works in one area in terms of the service you provide, care provision led, might work brilliantly in one area but not translate to another. So the way that we approach attraction at Cohesion is very much get your message out there as wide and far as possible, and that's both an online and offline approach. We've seen probably less offline during COVID, so things like posters up in local shops and community spaces that perhaps haven't been open, but as they start to reopen, offline attraction can really impact. In terms of online advertising, for us, Indeed is the UK's #1 job board and where we see a lot of our traffic come in. What we also find is that, obviously, as you will know, perhaps traffic and volume does not always translate to quality. So that's where we have to make sure that we're putting a really quality assessment piece behind the advertising. Job boards have done a really good job of allowing candidates to apply with one click. And that's great in one sense, because it means it's really easy for a candidate to register their interest with you. But what it also means is that candidates will probably be applying left, right and centre to you, the competitors down the road, the supermarket, all the different other opportunities that are available in that local area. So you really do need to look at what screening and assessment tools you put behind a process, whether that be care character, whether that be a values-based telephone interview. But certainly the online job boards, if you use them right and you put that screening in place, definitely look at putting relevant sponsorship behind Indeed adverts. You can definitely use online job boards, not just for advertising, but if you have the ability to have access to their databases, so you can proactively speak to candidates and reach out and tell them about your opportunities. So I'm not sure if I've answered your question around cost efficient, but for us it's about getting the message out as wide and as far as possible. And as Amanda said earlier, thinking about your audiences, that people that already work for you, where would they hang out, where would they come and look for a job with you, or are there groups that you're underrepresented by within your organisation, and how can we target those as well?
Yeah, thank you, Dave. And yeah, I mean, it's a really difficult one to answer. Kind of, it's definitely this is the way that you should go, because the demographics, depending on what town you are you rural, are you not rural, what does the local population look like, they all have an impact. But again, happy, Simon has our details if you want to give us a call and talk that through with me or Dave or somebody else on the team at any point. Happy to do so, because people are interested in working in social care, and if you can bring it to life for them and give them a great recruitment experience, then I don't see any reason why you couldn't be very successful recruiting.
And I think, did I see a hand up? Was it Juliet?
Yes, I did put my hand up and then I took it down. I think for me, we always get quite a lot of interest from the younger generation. So that 18, 19, 20s group. I am really passionate about trying to recruit the older generation, because running a care home for older people, sometimes there is a better link there. And also I like to have a real variety. So we've got and I know this is completely un-PC, we've got what I call the babies, and then we go up through the generations. So there is something for everyone. And I just wonder how you tap in to that slightly older age group. You can do the colleges, skills for care look very much at the apprenticeships and doing that sort of thing. But is there any way we can tap into all those unemployed people that maybe only want to work a couple of days a week. I mean, care is an ideal occupation if you are on benefits, and I'm not saying that in any sort of discriminatory way, but single mums, it's a perfect job for single mums in their 30s or 40s. You know, we can be flexible around those hours and keep their hours down so that they still get the best out of working and benefits.
Juliet, that's music to my ears, hearing somebody saying, I'll take part-timers a day, 2 days, and we can work around school hours. Brilliant. That's awesome. And I think any audience that you want to tap into, you start with who have you got in your workforce that's like that now? And where do they hang out? Where do they go when they're not at work? What do they read? Where do they shop? You know, and then you kind of plot, you know, are they on, people talk about social media and Facebook, and you know what, most people on Facebook are middle-aged women. Young people don't use Facebook, middle-aged people use Facebook, mainly because we've archived our children and families' lives from the point that Facebook existed, and so now they all go somewhere else. So it's that piece around where will I find them, and then how will I engage with them. And quite often, and I challenge you all, if you have a look on Indeed or the Job Centre website, which will have thousands of jobs for social care, honestly, they're all quite boring. And I hope nobody takes that personally. They tend to be great big long lists of, we want this and you must do that and you must do this and this is this and this is that. Actually, if you were, you know, if you were somebody thinking about how could I work part-time, how could I get involved back in the world of work, how would you write that ad to that person? And it is writing them differently, and you know, maybe writing one for older people, one for working parents, one for men with a picture of a man.
Oh God, yeah, I'd love to employ more male carers, particularly in that slightly older age bracket. And I don't know how far you can, in inverted commas, lie in a job advert. So normally you'd head it carer wanted, but I'm wondering if you know of any other words that we could head up that advertisement that would catch people's attention, and then later down, you know, they discover it's care, but you want something that
tricky one. It's a tricky one because of how they categorize it on the job boards, isn't it? So it's hard to cut care and support worker. Depends, but there is something in writing an ad for somebody not looking for a job in care where you describe what it is. And we've certainly taken that approach before. I've probably got some white papers on our website that we could share about how, you know, how you can target more men in frontline roles, how you can attract different audiences, what you should consider when you're thinking about rewriting ads. Again, happy to share those, Julia. We'll do some afterwards.
We've had a good comment come in from Debbie Smith. Thank you, Debbie, and you're absolutely right. So they have specific shifts that start later for mothers. So they start at 9 a.m. You know, how often do we see an ad where it's a 7:30 start and there's no flexibility around it? The staff also can finish at 2 p.m. So it's fitting around that school hours. So absolutely, the flexibility will speak 1,000 words in adverts. However, what we also see is a lot of adverts where providers will say, we're flexible, and then in reality, they're not flexible. And actually, you're having an adverse effect in those instances because you're saying you're one thing, the candidate engages with you, you tell them something different, and what happens? They go and tell their friends and their family and everyone else that works in care, and you start to build up that sort of, you know, you're sort of setting yourself up to fail, so to speak. So definitely, you know, think about where you can be flexible, and then where it's appropriate, that's what you would be putting in your adverts. And then we had another question coming from Rima that I'm just going to take, and then I can see there's a couple of hands up as well. So don't worry, we won't miss you. So we had a question coming from Rima around recruiting for domiciliary care specifically. Interestingly, we were speaking to quite a large community-based provider only last week, and sort of looking at what they're doing and how they can better position themselves in the market. There is no doubt that recruiting for dom care is one of the hardest places to recruit. I'm sorry to say that for those of you that are dom care providers. But it is about looking at your offering and making it really clear in your adverts. So, getting across in your adverts things like really detailing what that pay breakdown looks like. So, what mileage is available, how you pay for travel time, what that looks like. Be really clear in your adverts about what they're expected to do. We definitely see a lot of providers in the dom care space perhaps not being able to offer guaranteed hours in terms of contracts. If you're not able to, I definitely say reconsider, look at that. For the people that want some guaranteed hours, the 0-hour contracts might not work for everybody. People want to know what the ability there is to provide good care. So if you're a provider that stands by, we're not asking you to rush in and out of somebody's home and deliver care in 5 minutes. You will have time to spend with your clients. Good carers want to hear that. So definitely get that across in your adverts. Drivers, obviously, 9 times out of 10, you're going to be looking for drivers. That makes it all the more harder. You're obviously, making the funnel so much smaller, and we get that it's difficult to consider an alternative. If you use job boards, though, you can set up watchdogs. So the minute somebody registers with a driving license, you can be the first people to hear about it. So you can jump on them really quickly. So yeah, it's just about being really clear and honest about what you offer. Think about, again, like Amanda says, the people you currently hire, why have they chosen to do what you do? What do they love about their role? How can you get that across in the advert? Better still, can you film them? Can you put that on your website and use that in your recruitment material as well? So hopefully some useful tips there. I did see a hand up. Is it Sandra, I want to say? Did Sandra have a question?
Yes, it did, yeah.
Hi, Sandra.
Hi, it's about vaccinations and what your thoughts are on on the vaccinations and legalities.
Oh, yeah. Well, I be really careful here, as we're not legal professionals.
Yeah.
But certainly in terms of, we've seen a real mix in terms of probably how you've read it. There's a real divide in terms of what we're seeing in terms of the approach providers are taking. So some will take the route of making it mandatory, some will not. What we tend to see is that we will be asking candidates within the recruitment process, their stance, and then considering that on a case-by-case basis.
Okay.
And I think it's probably best to take that approach rather than generalizing or making something, this is our sort of one size that perhaps doesn't fit all approach. You should really be considering, what is there a reason behind why somebody wouldn't be comfortable in having the vaccination? So that's the approach the majority of our clients are taking. It is a difficult one, and there is so many arguments for and against, which we could probably debate about all afternoon. But I think from a recruitment perspective, it's really important that you have that conversation up front, and you just consider, have the conversation with the candidate, and then decide, whether that is suitable for the type of care you're providing.
Yeah.
Dave, can I jump in there?
Yeah, please do, Simon.
Yeah, just very quickly to say, I completely agree with everything you've just said on vaccinations. Towards the end of May, our legal partners at Wells will be doing a brief webinar, and we will touch on this subject then as well. If anyone wanted to join us, we'll share details.
Yes, please.
Julia, I've just seen Has Anyone Tried Radio advertising. I can't think of a provider that we've worked with or know of who've had significant results from radio advertising. Tends to be very expensive. But it's really difficult, because if you have a super popular local station, depending on where you are, and they give you a deal, sometimes things change over time. It might be worth a try, but if you're being quoted something expensive for it, then I would feel quite comfortable saying that.
It's just a question because it's something I've thought of, that you could roll together an advertisement for your business alongside recruitment.
Well, I tell you, I suspect a much more cost-effective one, which we've recommended to quite a few of our clients. You can get magnetic decal signs for the side of your car for about £35. So, you know, if you're a dom care business, or even a local care home, and you want to get that word of mouth out there, there are things like that could have a really similar impact but a longer shelf life. And I'd probably recommend having a look at some of them rather than radio, because it's just so transient.
Thank you.
That's okay. Any other questions? No. Right. Okay. Well, as we said at the beginning, we will be sharing the slides. We'll have a look through the notes at everything else that we've committed to share as we've worked our way through the hour. But yes, so and we'll come back on next steps in terms of what to do to sign up for the trial to use Care Character for your next 2 hires. Failing that, if you just want to pick up the phone and get in touch, all of our contact details will be there. But thank you so much for listening today. You've been a really great audience. I certainly hope it was helpful.
Thank you.
Thank you, Amanda. Thank you, Dave. Thank you to everyone that's joined us. Bye.
Bye, everyone.
Bye.